Welcome to Cosmetic Networks Live, where we explore the aesthetic and the cosmetic industry from the inside out. Hi, I'm your host, Sheila Maitland, and this is episode 71 for Tuesday, February 11th, 2014. Our very special guest today is Dr. Andrew Cohen. Dr. Cohen is a board-certified plastic surgeon. Welcome, Dr. Cohen.
Thank you for having me.
We're glad you're here, and we're going to jump right into what inspired you to be a plastic surgeon.
I get asked that a lot. For me, it was different than a lot of people. I grew up in a medical family. My father was a general surgeon in Huntington Beach, did a lot of surgeries. And for us in my family, I have three older brothers that are also doctors and surgeons. It was kind of a rite of passage to go into the OR with my father and watch him operate. So it's a little bit unusual than other people. So at 13, I got to watch him operate and was pretty impressed with it. And when I was in high school, he was doing a mastectomy, which means removing a woman's breast. So he takes this woman's breast off and he kind of plops it in a pan, sorry to be so graphic, but then the plastic surgeon walked in and created a new breast out of an implant. So my father says to me, and I'm probably 17, he says, Andrew, wasn't that great? Wasn't that a great surgery? We took care of her cancer. And I said, Dad, the plastic surgeon came in after you and he did the fun part. He's got the good job, Dad. And so my dad realized, yeah, maybe you should do plastic surgery. So at that young age in high school, I actually got to really watch a plastic surgeon, watch him operate. I formed a close relationship with him. And that really inspired me to really say, you know, maybe I can do this. And I had a little bit of an artistic bent in terms of being musical and playing piano and drums and this sort of thing. And so I have to say my father really encouraged me a lot to be a plastic surgeon.
That's really a great story, and especially I have brothers that are also in surgery and physicians. That's really makes it fun for family time, I'm sure. Yeah, the conversations are pretty much about anatomy, and it's all medical. So if you're not in medicine, you really can't eat at the table. That's pretty much right. Well, Dr. Cohen, you have lots of fun energy, so I want you to share all the fun different topics of hobbies that you have going on in your life.
Well, I do a lot of things. I have three sons. They're 14, 11, and almost 8, and I've been married for, I think, 16 years now. So my wife and I, Jill and I, spend a lot of time with a family. We like to travel. We're going skiing this weekend because I figured, it's President's Day weekend. We got to get up to the slopes. In California, we don't have great snow, but we have something up there. So I do a lot of skiing with the kids. We do a lot of traveling with the kids. I try to take care of myself. I run half marathons. I've done 8. So I'm always in training for a half marathon. We have one coming up. I just did one 2 weeks ago, and I have another one coming up in May. So I would have to say running, exercising, traveling with the kids. I do play piano and guitar, although it's hard to keep up with that sometimes with a busy surgery schedule.
Well, let's talk about a charity or a cause that you support or have supported in the past.
I support a few charities. I think that sometimes when I tell people that I've done a mission trip, and we did do that back in 1999 through my residency at Loma Linda. Every resident gets to do a mission trip. So I was fortunate enough to do a mission trip in Argentina. We did a lot of surgeries, cleft lips, cleft palates, scar revisions. I would like to get involved in doing another mission trip here in my practice, but I'll be honest with you, I've been very busy and it's hard to take a week or 2 off and go do a mission trip and leave my family and my practice. But it is something I will do in the near future. I mean, that's really what I want to do. And I think that's part of plastic surgery. Every plastic surgeon does some sort of give back. Here in Los Angeles, I'll be honest with you, just taking ER call, emergency room call at Cedars-Sinai, I feel like that's my giving back. Because that's really where you don't have to go travel to do charity. You don't have to go travel to India or another country to do charity work. We have people in Los Angeles who have no health care. So I do take call at Cedars-Sinai, and I have for quite some time, and that is how I feel by taking care of someone with no insurance and they need a plastic surgeon, they're in a car accident. That's been my charity work that I do right here where I don't have to leave my family or practice, and I can give back right here in the city of Los Angeles.
Boy, I think that is awesome. That is just very, very important, and sometimes people do feel like they really need to travel, but you're right, it's in our backyard.
It's here, and so there are ways that you can contribute right here in the neighborhood.